I'm Dr. Sadanand Patil. I'm a medical oncologist. I work out of the offices from Baptist East and Baptist DeSoto. I have a special interest in lung cancers, melanomas, and GI cancers. We have our normal body processes produce a lot of secretions in various parts of our body, starting with the saliva, the stomach secretions, the bile secretions, the pancreatic secretions. All of these have to be drained through natural passages and excreted. If they cannot be excreted properly, or if one of the passages is blocked for some reason, these fluids are going to get built up in your body, and they can cause serious complications. Surgeons can make surgically produced outlets to drain these secretions when, for some reason, the normal passages are blocked. This can happen at various levels. Some say if there is a blockage in the swallowing tube and you cannot swallow your saliva, the surgeon will need to make a stoma to just drain the saliva. If the blockage is further down in your intestine, if you cannot drain the stomach secretions or the bile out, you can get stomas just for the bile or just for the gastric secretions. And sometimes stomas can be placed for the small intestine, the large intestine, or even the urinary tract to overcome blockages in these systems. The blockage can be temporary, and the stoma can be reversed many times, but sometimes in cancer patients, the stomas can be permanent. When we bypass the normal channels of flow in our body system and make surgically created stomas, it is a big change for many patients. And we have lot of support to help patients go through this transition. We have stoma nurses who help train people how to use these, and the surgeon and the medical oncologist before and after the stoma will always be available to help with your care. Now, this change is definitely a big change, but it doesn't have to be a change for the worse. Many people can continue to live a completely normal life with either of these stomas I described previously. You can eat almost anything when you have a stoma. There are no definite restrictions. You'll be able to enjoy going to a restaurant and do any physical activities. There are prosthetic devices available to cover up the stoma and to hold it in place, so people can actually swim, wear swimming clothes without without the stoma looking obvious. And you can run, you can jog, you can do your regular exercises, you can do your regular work. You will obviously have to take some precautions, especially sometimes weightlifting can be a problem. Lifting heavy weights can be a problem with stomas. You'll have to take specific precautions to hold the stoma, to support the stoma if you have to lift heavy weights. Sometimes keeping the stoma clean requires extra effort, and you'll have to keep changing the stoma bags frequently as needed. People can take long trips with adequate preparation, adequate supply of stoma bags and supplies.